By definition, it's a term that means unfair. Inequality impacts many different groups and stretches across many different issues, from race to gender.
And so it's a different vibration when you see someone that looks like you working on themselves.
Pay to health. This week we're looking at what's being done to push back against inequality in America. This is The Race. Right now we're heading into a museum that bills itself as the largest collection of racist artifacts in the United States. There are images in this story that will be difficult to look at, and there are many pieces that we just can't show you on television. But the people who are in charge of this museum tell us that by seeing their exhibits with many relics from the past, we can have better conversations about issues of race and inequality today. The elevator ride down to this Michigan College library basement may be quick, but David Pilgrim hopes when you see what's kept here, it will leave a lasting impact.
What we're trying to show people is just the sheer volume of objects that mocked and belittled African Americans.
David is a sociology professor and the founder of the Jim Crow Museum at Ferris State University. For 40 years, he's collected many of the racist items on display here, from symbols of segregation to caricatures that portray negative stereotypes.
I can teach the lessons I want to teach about Jim Crow, about what it was like to be black growing up in that period, and white, and I can do it by objects.
This museum shows the lasting impact of Jim Crow, a name first given to a black-faced caricature performed by white actors meant to belittle African Americans in the 1800s. It became the term used to describe the era of racial segregation that lasted until the 1960s.
In the museum, we use something called visual thinking strategies, which is we ask a person, what is it you see? At one time in the U.S., whipping posts were legal. Black people and poor people were disproportionately whipped on whipping posts. When I ask people what is it they see, which is I could ask you, what is it you see? Almost everybody sees this little boy, right? And they imagine what he's thinking, watching in a public square someone being whipped.
The power of this museum, David says, is in the debates over the everyday items, ones we may all recognize.
We bring together people from, who have different perspectives. So one group of people look at this and they think, these are the vestiges of enslavement and Jim Crow. And then someone else looks at it and just thinks, this just reminds me of good times that I've spent with my grandparents.
One example he gave me was the debate over the Aunt Jemima breakfast brand, retired in 2021. While popular in so many kitchens, according to historians, she was not a real person. Instead, a caricature based on stereotypes dating back to before the Civil War.
It was a marketing ploy, is all it was. And it worked, right? This associating a black woman with wholesome cooking.
Some might dismiss what's on display here as problems of the past. But David says many of these racist items are still being made and sold today.
There's not a single object in this museum that's not being made right now. Some variation of that object is being made right now.
Are you ever surprised by that?
No, I'm not surprised. I'm disappointed.
Emotion, he says, is part of understanding history.
The purpose of studying the past is to better understand the past. Then we can do stuff when we have that deeper and more nuanced understanding. But it's not to make you feel better, not to make you feel worse either. It's to teach and learn what really happened.
The museum has a virtual tour online that allows anyone to experience it. Ferris State is in the process of planning a new facility as the museum's collection has grown far beyond the personal one David started as a teenager.
I believe America could still be that city on the top of the hill, but we're not going to be it if we ignore the lessons that we should learn.
An important message about the future, charted by recognizing the difficult parts of our past.
There's no denying the history 1 mile east of downtown Atlanta. It's the birthplace of Martin Luther King Jr., the home of Ebenezer Baptist Church. Within a mile's walk are testaments to black persistence.
This is our community. Our office is located 2 blocks down from here.
But Luis Negron and many like him work to protect this community today, which on this day means speaking up about the 7-story chasm that now exists. What was your reaction when you heard this hospital was closing?
I was devastated. My heart was devastated for the community to know that they won't have access to health in this area.
We speak on the sidewalk of what was once a hospital. It was first called Georgia Baptist Hospital and most recently Atlanta Medical Center. Now there's no name. The hospital shut down in November, part of what some see as a pattern.
People have been here for generations. With it now being gone, it's going to be a plight in the community of health care and access.
When we are talking about hospital closure, it's mostly rural.
Janani Thapa teaches and studies rural-urban disparities at the University of Georgia. For a decade, the narrative around hospitals shutting down has focused on the nearly 200 since 2005 that have closed in rural areas. But in recent years, hospitals have shut down in Chicago, Philadelphia, D.C., with a similar pattern to Atlanta.
We are a state where we need to do a lot of work in making sure that everyone has equal access to health care.
On August 31st, the nonprofit overseeing Atlanta Medical Center announced plans to cease operations. Wellstar pledged to continue its commitment to the 1.6 million Georgians across our diverse communities. But the communities it vacated in Atlanta and south of the city East Point are largely low income and black. This isn't an isolated space somewhere.
No, it's not. But I would say the community is very isolated.
When rural hospitals close, residents are often left dozens of miles from the nearest option. In cities, there's at least the illusion of access. Grady Hospital is in the heart of downtown. It's now Atlanta's only Level 1 trauma center.
This was a walkable hospital. So many people will walk here during the day, during the evening. If there was an emergency, they could get here very quickly. Even though we see Grady is actually across the highway in a corner, it's a much more difficult track to get there than this one here.
In November, leaders at Grady declared it isn't going anywhere, but acknowledged an influx of patients in our emergency department and trauma volumes. The future of the former Atlanta Medical Center is unclear. But when it comes to access to health care, it's another reminder of the many issues that affect two communities that rarely communicate. Those miles away from the city and those 1 mile away from downtown.
I think it's a loss in the community. I think it's a lost opportunity.
In Atlanta, I'm Matt Pearl.
Across the country, access to health centers and fitness centers is something hard to come by, which is why black business owners are trying to improve their community by opening these types of businesses up.
Fitness was more so seen as a luxury than a necessity.
30 seconds.
It was rough. I can't say that I've always had access to the gym.
We kind of, I hate to say it, but kind of live to get by a lot. And that's been kind of a generational thing, I would say.
No matter which city you go to, there's an issue of accessibility to certain lifestyles when it comes to minority communities.
I grew up on the west side of Detroit, and what our healthy foods were Subway, processed foods.
I don't think we were privy to all of the benefits that come with living a better lifestyle. That includes fitness and how it prolongs longevity.
Whether it's a lack of access to food, a pharmacy, or hospital, these are all considered health issues.
COVID slowed everything down. When you see so much death and it happens just like that, you start to appreciate life a little bit more and start to take care of yourself a little bit more. The way to protect yourself during COVID was to be in great shape.
But there's another growing issue that Black business owners are trying to solve, and that's the access to centers dedicated to fitness, wellness, and health. One of the major health issues in the Black community is obesity. 38% of men over the age of 20 are obese, and 55% of women over the age of 20 are obese. And experts say accessibility to health centers can be part of the issue. Health, fitness, and wellness center memberships are low among the Black community. Studies report that only 12.3% of health club members in the country are Black, compared to 66% that are white.
I really didn't get access to a gym until I got to high school.
When I got into yoga, I was the only Black person in the classroom often. It wasn't until I started venturing further out into the areas, getting interested in yoga and meditation, where I had to go to Birmingham, I had to go to Novi, I had to go to Rochester in order to get these things.
Our people really suffer due to our eating habits, other things like not working out properly, not having a full understanding of how to work out.
How things changed?
I think things are changing for the better. We are getting more representation out there.
In these communities, a lot of gyms have closed down, like this one. This is why Black business owners decided to create their own wellness and fitness centers in the very community they grew up in to involve more people of color.
I'm Jamel Randall, owner of the Trap Yoga and Massage Studio. Just last week, I had a lady come to the class. I had never seen her before. It was a Black lady.
You can leave the arms by your side or take them above your head.
She's like, it just feels good to do yoga with Black people. You know, it's never about isolation. It's just, and so it's a different vibration when you see someone that looks like you working on themselves. It's inspiring and it's promising for the future as well.
Here is the game plan. We're gonna do front raise. Here. My name is Clarence Gleaton. I am AKA Mr. Kratos. We need to see other people like us working out as well.
One, switch. That's right, still in it.
I think the more we're out here, putting ourselves out there more, the more we can affect some type of change, especially dealing with mental health.
But it's more than just physical health. Mental health plays a crucial role in the Black community. 16% of the Black population reported having a mental illness in the last year.
All day, I come across people that struggle with their mental health. And I know one of the things that helped me, even when I was serving in the military, was fitness.
Women are phenomenal. Let's go.
Well, representation is everything. I'm a woman, African American woman, and I'm not a size 2. I'm a power lifter. So a lot of times when people see me,
Fight. We only got a few seconds left here. Keep going.
they assume that, oh, well, how can she train someone? Don't be so quick to judge. I suffer with anxiety and depression. I've been at the bottom and I know what it feels like to feel hopeless. And if I had allowed those things to take me away in my darkest, I wouldn't be here now.
Wellness centers can be a way to encourage those in their community to use fitness as an outlet for mental health, because the Mental Health Foundation says exercise can lower depression by 30%.
This is the vision of a lot of people just like me who are in this area, Black studio owners, fitness owners, and trailblazers in the community that are saying, we're going to change the narrative in the city of Detroit, and it starts with us.
Thomas Hoppo, Scripps News, Detroit.
Inequality also impacts our health, and we will show you the efforts to get rural Americans specialty health care, often only available in big cities. Next on The Race.
Driving an hour and a half or more to a doctor's appointment is a reality for a lot of people in rural communities. That's why healthcare centers are working to use new technologies and telehealth to help.
Mr. Kevin, how are you feeling?
This is a demonstration.
Can you please raise your right leg up for me?
Of how a patient in a small town who experienced a stroke can be seen by a neurologist hundreds of miles away in a matter of minutes.
We think this is, acute stroke going on right now. We can get the same level of care as we do in any primary hospital.
Dr. Murali Kolikonda is a neurologist with Baptist Health Lexington.
So can we just start getting some scans on him?
Yes, sir. I'll get some orders in.
He makes sure patients in rural areas receive the same quality of care, even without the same resources. How has teleneurology helped that gap?
There has been a huge divide between urban and rural care in terms of access for a neurologist.
Touch this finger to your nose.
For years here, we had very limited access with neurology.
Christopher Troxel works at Baptist Health in the small town of Corbin, almost 100 miles south of the closest major hospital.
It's essential for a small community. Again, many times folks have not seen neurologists in years when really they needed to.
The use of teleneurology is growing, not only to help in situations like caring for a stroke patient, but for ongoing care or help with other neurological conditions from a distance.
We're finding that 40 to 50% of patients can be cared for locally without even having to be transferred to a major tertiary center.
Teleneurology isn't a solution to everything.
It still doesn't replace a bedside exam.
Can you please raise his leg up for me?
And certain tests and procedures may require an in-person visit, like a CT scan.
Okay, thank you. Can you please do this with this hand?
Regardless, it helps for a specialty already stretched thin.
We have a shortage of neurologists worldwide.
Why do you think it might be difficult to get a neurologist here, on staff?
We've been recruiting on and off for a neurologist for years, but it is very difficult to recruit to a small rural area.
Looking at the blood vessels to see if there's a blockage.
Neurology is just one example of how advancing tech can better health care everywhere.
It has improved the outcomes.
Even here in a rural area where folks are often resistant to change or resistant to technology at times, it's opened up another world for them. We may see more subspecialty telehealth services in the future.
I'm Chloe Nordquist reporting.
The race continues. Next.
Researchers found that men and women have been getting vastly different advice for heart disease, and they found that the advice women were getting could negatively impact their health.
Cardiovascular disease has traditionally been thought of as a man's disease.
Dr. Catherine Lindley says fighting heart disease is also a fight against gender stereotypes.
It's been a long recognized issue that both women and their clinicians tend to under-recognize women's risk for heart disease across the spectrum. It accounts for about 1 in 3 deaths in women. So really, we're all essentially at risk for cardiovascular disease.
She says women tend to develop heart disease later in life and more commonly have symptoms of fatigue and shortness of breath. Those are symptoms that men don't usually report. So over the years, this has contributed to heart disease in women being overlooked. And Dr. Lindley says even when women do present symptoms, they're less likely than men to be prescribed medication.
In general, we know that men tend to be treated more aggressively with cardiovascular medications, even when presenting with a heart attack.
Knowing this, researchers from Massachusetts General Hospital looked more deeply into gender disparities in heart disease treatment and prevention. Doctors found men were 20% more likely than women to be prescribed medications to lower cholesterol and manage their heart disease. Meanwhile, women were 27% more likely to be advised to lose weight. and 38% more likely to receive recommendations to exercise to deal with their heart disease. Dr. Lindley says from her experience, she thinks both men and women should consider diet, exercise, and medication.
They both need to be treated as aggressively.
And getting more aggressive with women's heart disease starts with doctors and their patients ditching stereotypes and changing the conversation so that women are encouraged to attack this deadly disease head on and early on. Alexa Liaco, Scripps News, Denver.
From the campus of Ferris State University in Michigan, I'm Chris Stewart, and this is The Race.